Yesterday I talked a little bit about Ohio's prisons. And again, the director has done she and her team have done a very, very good job in keeping the virus out of the prisons for a long time. We saw this past week that it had entered two of our prisons. And that was to be expected despite all the best efforts of the director and her staff. We talked yesterday about the importance of going through and looking to see if there were areas where we, in fact, could reduce the prison population. Prisons pose a unique challenge in this pandemic. Social distancing in the general population, as you know, is helping us flatten the curve. You all have done a great job. But when we're dealing with prisons, prison inmates, and correction officers, it's a different situation. The social distancing becomes obviously much more challenging. In regard to our prisons, we have a number of responsibilities that we take very, very seriously. First, we must do all that we can to protect prison staff. The vast majority of them cannot work from home. We need them. We appreciate them very, very much. And we must give them the best, safest working environment that we can. Second, we have a responsibility to protect the inmates who are in our custody. And that certainly includes trying to protect them and the staff from the COVID-19. Third, we also must protect the public from those who may cause them harm. And that means many of the people who are in fact in prison. Social distancing in prison is difficult. Now, I do want to share some good news that the director shared with me. The intake coming into the prison, this is a fluid population. Every day people are coming in, people going out. People who serve their sentences, people who have been sentenced are coming in. The intake is now down for the last week or two, about 20%. That will certainly begin and has begun to reduce the population in prison. And I want to thank the people at the local level, our judges, sheriffs, and others who have been involved in that. Last week, I asked judges to consider the early release of 38 select offenders, 23 of whom are pregnant or postpartum women. I also asked at that time for the judges to take a look at 15 inmates ages 60 and up who are already approaching release. In other words, they are within 120 days of release. And so we did that, and we sent those names out with letters to judges around the state of Ohio for them to take a look at those particular prisoners and see if they would be eligible under the statute for judicial release that can be controlled by the local judge. Since then, my team has continued to carefully analyze our prison population. Finding inmates to release from prison to create more room for social distancing is frankly not easy. We have around 49,000 people in prison today, and each one of them is there for a reason. Murderers, sexual predators, people like that, we're not going to let out. We're just not going to do that. We have no intention of releasing them back into society. To protect the public, we must be smart and targeted about who we recommend for release. Let me talk about the first group that I'm announcing today. There is a long-standing statute, Ohio Revised Code 6.18 that allows the Director of Ohio's Department of Rehabilitation and Corrections to alert a group called the Correction Institution Inspection Committee of an overcrowding emergency and recommend that certain inmates be released to make more room. The CIIC is composed of members of the Ohio House and the Ohio Senate. Their purpose is to assist in the state's efforts to ensure a safe and humane correctional system. We are in an emergency that makes the situation more urgent. We are in unprecedented times, which is why I'm announcing today that we are moving forward with this process and are notifying the CIIC of overcrowding in our prisons. To help relieve the situation, we believe that there are specific inmates who are already scheduled, already have a release date within the next 90 days. So these are all inmates who are within 90 days or less of being released anyway. Now, again, let me be clear. We're not asking that everyone who is scheduled to be released, everyone who is within 90 days of their time be released. We start with that number, and then we start narrowing it down. I want to just share with you the process that we went through. So we first started with people in our prison who are now within 90 days or less of the date when they will be, in fact, released. We then began narrowing that list down. We then eliminated those who were convicted of serious charges, such as sex offenses. We eliminated them. Those who are homicide-related offenses, we eliminated them. Kidnapping, abduction, we eliminated them. Ethnic intimidation, eliminated them. Making terrorist threats, we eliminated them. Domestic violence, we eliminated them as well. We have also screened out those who have been denied in the past judicial release. We screened out those who have a prior incarceration in Ohio. We screened out interstate offenders. We screened out those who have warrants or detainers on them from other states or somewhere. And we also screened out those who have serious prison rule violations at any time in the last 5 years. Once we did that, that left us with 141 inmates who qualify for emergency release under Ohio's overcrowding emergency statute. All of them have a release date on or before July 13th, 2020. Now, these 141 inmates are all in our minimum security prisons. Prisoners in these facilities live in what's called open bays with 80 to 300 people in a large open room. They sleep in bunk beds with 3 feet or less between them. Because of this setup, this is where we have the potential for the fast spread of COVID-19. Again, these are individuals already approaching the end of their sentence, and releasing them slightly earlier than planned will create more social distancing for those who will be kept in custody. So I encourage CIIC to give this issue their immediate attention. That's group one. Now, let me turn to a second group and describe how we are handling them. Again, under a different provision. There is another much smaller group of inmates who we believe should be considered for release. These are inmates who are age 60 years of age or older and who have a chronic health condition. Again, we started with people who are 60 years of age or older and have a chronic health condition. That makes them obviously more vulnerable to COVID-19. And we look for those who had served at least half of their sentence. We looked at this group, and then we started screening out. We screened out anyone who has been convicted of serious charges, such as, but not limited to, sex offenses, homicide-related offenses. We screened out anyone been convicted of kidnapping, anyone convicted of abduction, ethnic intimidation, making terrorist threats, and screened out anyone who's been convicted of domestic violence. We also screened out, among this group, people who have been denied judicial release in the past, people who have had prior incarcerations in Ohio. They've been in Ohio prison before. Those who are interstate offenders, those who have warrants or detainers on them currently, and those who have had a serious prison rule violation in the last 6 years. So we started with those 60 and older, those people of 60 or older who have an underlying medical condition, chronic health condition. We also took out habitual offenders, those with 2 or more prior convictions. This left us with 26 inmates statewide. As I explained yesterday, under the normal procedure, I cannot quickly grant a commutation. And obviously, this needs to be done quickly. Under the law, we must give prosecutors, judges, and victims notice of at least 60 days, and that makes sense. And that's after all the paperwork has been filed. Because of these individuals' medical vulnerability, the fact that some would not qualify for judicial release, and the need to consider these cases quickly, I'm taking the following action. We are asking judges and prosecutors across Ohio who are associated with these individuals to waive the 60-day notice so that they can take these cases directly, so that we can take these cases directly to the parole board. This will be a decision then made locally by the judge, by the prosecutor. The parole board is prepared to meet starting this Friday to consider these matters. Now, in these 26 cases, it is a statutory requirement that the parole board consider and make a recommendation on each of these cases. In those cases where there are specific victims, those victims must and should receive notice, and they will be given the opportunity for their voices to be heard. After the parole board makes a recommendation on each of these 26 cases, I'll act quickly to make my decision in respect to each case. If the parole board recommends that a sentence be commuted, the parole board can also recommend, and many times does, additional conditions upon the release of that inmate. As governor, I can accept those conditions or I can add additional conditions as well. If in the future then the conditions are violated, we'll send that individual back to serve the remainder of their sentence. Overall, these are all tough decisions. We're trying to take a measured and responsible approach that protects the public, but also tries to minimize the spread of this virus in our prisons. Now, we have a list of all 160 inmates who are up for potential release, which will be made available to the press corps that's covering this afternoon, and then will be available after that to the public.